Hip replacements typically last more than 20 years. In fact, you may know that they were rated as one of the best inventions of the 20th century, and I concur with that. Hi, my name is Jonathan Quayle. I'm a hip and knee surgeon at Salisbury. I'm going to spend the next few minutes talking to you about hip replacements. So what is a hip replacement? A hip replacement is an artificial joint that we use to replace your hip. We would do this for hip arthritis typically, although there are some other causes for doing it. What are some of the symptoms that you might get? Predominantly, people notice they've got hip arthritis when they start getting pain, sometimes stiffness, sometimes loss of function affecting their hip. The pain is typically felt in the groin, but it also can be felt deep in the buttock as well. It often radiates down the leg, and some patients come complaining of knee pain only to find that it's a hip replacement they need. In terms of loss of function, typically people notice that they can't walk as far and find climbing up or downstairs or over things much more difficult. They often have to give up the hobbies they like doing, like gardening or golf. And then in terms of stiffness, things like putting on your shoes or socks can become really difficult. If any of these things are affecting you, then it might be that you need to see a doctor to chat about it. What are the different approaches to hip replacement? When people start researching hip replacements, they often find that there's a lot of information on the internet about the different approaches you can do to hip replacement. The most common approaches to hip replacement are a posterior approach where you access the hip from behind the joint, or an anterior approach when you come from the front. Both these approaches are successful, and the evidence would say that in the long run, both people who have an anterior or a posterior approach do well. Ultimately, the most important thing is that you see a surgeon who's experienced in one approach or the other, as this is the thing that's most likely going to give you a good recovery. The anterior approach does have some support with it regards to a slightly quicker recovery in that first 1 to 2 weeks. However, this effect is largely disappeared by about 4 weeks. Are there different types of hip replacement? So there are lots of different types of hip replacement. Usually they're defined by the way the implant is fixed to the bone, or by the material used for the joint itself, so where the hip joint articulates with the socket and the head. In terms of fixation, the most common types are cemented or uncemented. Typically, the most common way of fixing it to the bone is using cement for the femur and using an uncemented socket. This is called a hybrid hip replacement. This combination has a very good long track record, and hip replacements typically last more than 20 years. If you're younger, there may be some benefit in having an uncemented stem as well, but you will need to leave your surgeon to help you make this decision. In terms of the socket, the joint itself, the options are using a plastic liner to the socket or a ceramic liner. And on the side of the femur, we use a ceramic head or a metal head. The evidence would suggest that all of these combinations do well, though if you are younger, having a ceramic head and a plastic socket may well be beneficial to you. How long do hip replacements last and what can go wrong with them? Hip replacements typically last more than 20 years. In fact, you may know that they were rated as one of the best inventions of the 20th century, and I concur with that. They're so good that often people can forget they've even had it. Unfortunately, there are some times when they can go wrong. These include where you dislocate the head from the socket. Sometimes you can put this back in and it doesn't happen again, but if it keeps happening, sometimes revision is required. You can get an infection, which will affect your long-term outcome, and this will require further operations. But we do everything we can to reduce that risk, and it is less than 1%. You can have a fracture around the implants, which usually requires surgery. And one of the other big things that can happen is you can get a clot in the leg that can go to the lung. If you take the medication we give you and mobilise straight away, this reduces that risk considerably. The final thing can be a discrepancy in your leg lengths. We plan the operations very carefully using computers and other technology, but unfortunately sometimes it doesn't go exactly right. Most people get used to a leg length discrepancy over time, but unfortunately some people require either a shoe lift or sometimes even revision surgery. How long does it take to recover from a hip replacement? A hip replacement is a painful operation, and for the first few weeks you will not be able to do very much. However, as you get towards 4 weeks or so, your function and ability to do things recovers and the pain improves. Most people, when they come back and see me, somewhere between 6 and 8 weeks, are mobilising either independently or just with one stick, and their pain is already a lot better. I would expect you to continue to recover after this point and return to doing the things you really enjoy from about 3 months onwards. So that's a brief summary of how hip replacements are done and the things that can go well or wrong with them. I hope you found the video instructive, and I hope I can see you in clinic if you need help with your hip problem.